Welcome back to the weekly Neurology Deep Dive. It's for educational purposes only, no commercial goal here. Today we'll be diving into acceptance and commitment therapy, ACT and how it can be used in your neurological practice. Consider this a brief overview, but we really encourage you to read the full paper. That's Acceptance and Commitment Therapy and Psychological Well-Being, a narrative review published in Curious just last month.
Okay.
We have an expert on ACT joining us today to unpack this.
Happy to be here. Excited to delve into this with you.
So for those neurologists who may not be familiar, could you explain how ACT is different from other therapy approaches?
Well, ACT shifts the focus away from trying to change or eliminate difficult thoughts and feelings. Instead, it's about accepting them, that they're just part of the human experience. It's about building a different relationship with those thoughts and feelings so they don't end up controlling your actions.
I see how this could be really important in neurology. We're always working with patients who are dealing with chronic conditions. And they often have a lot of emotional distress, too.
For sure. So imagine you have a patient with Parkinson's disease, and they're struggling with tremors, feeling they're losing control of their own body. Now, traditional therapies, those might try to minimize those tremors, maybe distract from the anxiety they're causing. But ACT, on the other hand, would help that patient acknowledge those feelings, the anxiety and fear. It would guide them to accept them as natural responses, and then help them focus on actions that are in line with their values, despite the tremors.
So rather than getting stuck in this cycle of trying to get rid of the tremors, the patient learns to live a good life, a full life, even with them. That's a really powerful difference.
It is, and this is where those 6 core processes of ACT are so important. They're the framework for cultivating what we're talking about. Psychological flexibility.
Okay, so let's break those down one by one. Let's start with acceptance. What does that look like, actually, in practice?
Well, acceptance isn't about being happy or even wanting those difficult thoughts and feelings, right? It's about making space for them. Think of it like having a house guest you didn't really invite. You may not enjoy having them there, but you acknowledge that they're there, and you let them stay without letting them completely take over.
So how do we help our patients do that? It seems like a tough concept to understand.
It is, and it takes a lot of practice. One technique we use is mindfulness. It helps people become aware of their thoughts and feelings right now, in this moment. And they learn to do this without judging themselves.
Is that similar to meditation?
There are similarities. We might have patients focus on their breathing or notice what their body feels like. Maybe just observe the thoughts that come and go without getting all wrapped up in them.
And this connects with the next process, right? Cognitive diffusion.
Exactly. Cognitive diffusion is all about creating space between ourselves and our thoughts. A lot of times we get caught up in our thoughts. We start to believe they're true or facts.
Can you give us an example of how that might look for a patient in neurology?
Sure. Let's say you have a patient with chronic migraines who keeps thinking, I'm never going to get better. That thought can become so powerful that it starts to control what they do. They might stop going to social events, avoid exercise, even withdraw from things they enjoy because they're convinced they'll always be in pain.
And that could have a major impact on their quality of life.
Absolutely. But using cognitive diffusion techniques, we help them to see that thought as just a thought, not a fact. We might use metaphors like imagining their thoughts as clouds moving across the sky or leaves floating down a stream.
So instead of being overwhelmed by the thought, they can just watch it go by.
Exactly. And that creates the space for them to act, to do things that are in line with their values, even if it means a little discomfort or some risk.
Which brings us to the third process, being present. So how does that work in ACT?
Being present means changing our focus. Instead of dwelling on the past or worrying about the future, we're fully engaged in this moment. Right now, this can be incredibly helpful for neurological patients. It helps them manage their pain, anxiety, even those really tough thoughts that can come with chronic conditions.
So is this about distracting them?
It's not really distraction, because distraction often involves trying to avoid or suppress those thoughts and feelings we don't want. But being present is about acknowledging them, letting them be there. But then we choose to focus our attention on the things we can actually control right now in this moment.
So what techniques help to cultivate that? Being present, I mean.
Well, we might have patients focus on their senses, like how their feet feel on the floor, the sounds they hear around them, the taste of the food they're eating. It's about anchoring them in the present, and that can loosen the grip of those intrusive thoughts and feelings.
That makes sense. It seems like all of these processes are connected somehow. I mean, you can't have one without the others, right?
You're absolutely right. They work together. They create that psychological flexibility we keep talking about. And this is where things get really interesting for neurologists because the next three processes, they're all about translating all this acceptance and mindfulness stuff into, actual steps you can take to move towards a really meaningful life, even if you're dealing with these neurological problems.
Okay, I'm following you. So self as context is the first of these, right? This one's always felt a little abstract, I guess.
Okay, so picture this. We tend to define ourselves based on our thoughts and feelings. Like, I'm anxious, or I'm just a burden. And that can be incredibly limiting, don't you think? Especially for someone struggling with a chronic neurological condition.
Yeah, for sure.
So, self as context, this encourages us to take a step back for a second, to recognize that we're not actually our thoughts and feelings. We're the context those thoughts and feelings are happening in.
So a patient, instead of saying I'm anxious, would say something like, I'm noticing some anxiety right now.
Exactly. Even that small shift in language can make a big difference. It gives the patient some separation. It lets them just observe those thoughts and feelings without getting completely swallowed up by them. It's like a reminder, that they're more than their diagnosis, more than just their pain, their fear.
That's powerful. And once a patient has that separation, then they can work on values clarification. Is that right?
Precisely. Values clarification is all about figuring out what's truly important to that person, to that patient. What gives their life meaning, purpose? What do they want to stand for, even with these challenges, these neurological issues?
And I think this is where, we as neurologists, we can really make a difference, can't we? We can help guide our patients through this.
Absolutely. Helping them connect their medical journey with what they value in life, with what they hope for. Totally. It's about changing the question instead of what's wrong with me. It's what kind of life do I want to live, even with these challenges? We might ask, if your condition suddenly disappeared tomorrow, what would you do? What would your perfect day be like?
And their answers can tell us a lot, right, about what they value most deeply.
Exactly. And once we have those values clear, then we can move on to that final process. Committed action.
This is where we actually make it happen. We put those values into action.
Absolutely. Committed action means setting goals, goals that fit with those values, and then taking steps to reach those goals, even when it's hard, even when there are setbacks, even when those difficult thoughts and feelings show up.
Let's say we have a patient with MS, multiple sclerosis, and they really value spending time outdoors. But they have fatigue, mobility issues. How would committed action work in that situation?
Well, it could start small, maybe committing to spending just 5 minutes outside every day, sitting on the porch, kind of a short walk around the block. The main thing is to start with something manageable, something that lines up with their values, and then gradually we can build up from there.
So it's not about pushing them to do a lot all at once. It's about helping them take those steps, those consistent actions.
Actions that come from their values, even if they have limitations. Exactly. And that's what makes ACT so powerful. It gives patients control of their own lives. It lets them live the way they want to, even with these neurological challenges.
This has been so helpful, really. I can already see how I can start using these ACT principles in my own practice. Before we finish up, I was wondering if you could share some specific examples. How have you seen ACT really make a difference for patients in neurology?
I've seen some pretty incredible changes, actually. I had this patient, he had a spinal cord injury, and he was really struggling, severe depression, feeling hopeless. He had been a big hiker before his injury, and not being able to do that anymore, well, it just crushed him. So we used ACT, and we worked on accepting those new limitations, but also on finding other activities that were still a good fit for him, things that aligned with his values, like he loved being in nature and he always liked pushing himself physically. So he ended up discovering adaptive kayaking. He even joined a group. I mean, it wasn't the same as hiking, of course, but it gave him that connection with nature again. And that sense of achievement, too. His mood really improved, dramatically. And he started to see his life as meaningful again, even with the injury.
That's such a great example of how ACT can help, isn't it? I mean, it helps people find new ways to be happy and fulfilled, even when they're dealing with these, life-changing conditions.
It's about shifting that focus, isn't it? Away from what they've lost and towards what's still possible. That's a really powerful change in how you look at things.
And it's not just our patients who can benefit from this way of thinking, is it?
No, not at all. As neurologists, we deal with a lot of stress too, a lot of burnout, honestly. It's a demanding job. The cases are complex. And seeing how much our patients are suffering, that takes a toll.
I think a lot of people listening probably know exactly what you mean.
I would imagine so. And the thing is, ACT can be just as helpful for us, as it is for our patients. If we apply those same principles to our own lives, it can help us deal with that stress, prevent burnout. It can help us build a career that's more sustainable, more fulfilling.
So what can we do? How can we, as neurologists, start to incorporate this ACT approach, into our everyday work?
Well, it starts with understanding those principles we talked about. We have to be mindful of our own thoughts and feelings first. Practice acceptance. And figure out what our own values are, what's important to us. It's about setting an example for our patients, both in how we interact with them and how we take care of ourselves, our own well-being.
And are there resources, like, for neurologists who want to learn more or who actually want to start using ACT in their practice?
Absolutely. That paper we mentioned earlier, Acceptance and Commitment Therapy and Psychological Well-Being, it's called A Narrative Review. That's a great place to start. There are tons of books out there, too. Workshops, online courses.
This has been so much formative, really. I think we've all learned a lot about ACT today and how it can really make a difference in the lives of our patients, maybe even our own lives, too. So any last thoughts for our listeners as they're thinking about using ACT in their neurological practice?
Just remember, ACT is a journey for you and for your patients. It's not about achieving some perfect mental state. It's about learning to live with those difficult thoughts and feelings, managing them in a way that lets you have a full life, a life that means something.
Thank you so much for joining us today. This has been incredibly helpful.
My pleasure.
We hope this has been valuable for you, our listeners. And until next time, keep exploring, keep learning, and keep diving deep into the world of neurology.